Hello and welcome to a brand new Ego with Dr. Coffey. I'm your host, Chris. Dr. Coffey, how's it going?
It's going all right. How's it going?
Doing all right, man. Before we get started, why don't you tell the audience a little bit about why you decided to start this show, which dives into mental health and therapy?
Just trying to bring awareness to mental health to people and kind of break the stigma surrounding mental health and just shed light on the mental health process from what people can expect from start to the middle stages to termination and to kind of enforce that it's not what people actually think it is. I have that a lot with clients. They'll start and they'll say, "Well, I didn't anticipate it being like this. It's not what I thought it was because, all they're, used to going off is movies or, some unpleasant experience that others have had in the past instead of witnessing it for itself." So just pretty much to spread awareness and as the short answer.
That's dope. That's dope. Before we get into some of the more exciting topics and diving into the intersection of mental health and pop culture and interviewing some folks and seeing how they could benefit from your insight and your expertise, wanted to have a short interview to give the audience a glimpse into how your journey started, some of the things that um, are signals for the need for mental health and some of the next steps that people can take if they feel that they may be in need of therapy. So, first, I like to start with your personal journey. So, what inspired you to pursue a career as a clinical mental health therapist?
Well, I was shot uh, 3 times in 2003, and subsequently, my friend that was with me, uh, he was shot 10 times and died. And long story short, I never was the same person again, didn't really know why. Um, then I had a friend of mine who was a mental health therapist, and we talked, and he referred me to some people, and I was diagnosed with what they call PTSD, not knowing what that was. I was educated about it, uh, learned how to manage my symptoms a little better because I had became a raging alcoholic, lost jobs, marriages, friendships, issues with family, you name it, the whole gamut. And it wasn't until I understood why I wasn't the same person due to trauma that I started um, actually working towards managing my diagnosis. And then, I had already had a business degree and a bachelor's degree. And he was like, "Well, man, I think you would be good to get into this field. You like helping people, and then your story." And I kind of toyed with the idea for about a year. It was like, man, no, I don't know if I really want to go back to school. And then I decided a year later when things weren't going well for me, um, I kind of lost everything. And I went back to school, and the rest is history, coupled with the fact that um, I wanted to educate people that looked like me on mental health disorders and how important they are in our community. So I went back to school and did my residencies and acquired my uh, second master's in licensed clinical mental health counseling. Then afterwards, I coupled that with my doctorate degree and began work in the field.
Going back a little bit, I know who your friend was, but for your audience, can you tell us the name of your friend who you lost when you were shot?
Yeah, his name was Quincy O'More Phillips. Good guy, good dude, man. He was he's one of those guys that had what people reference to as that it factor. He just had the it factor. Pleasure to be around. Just the energy, the aura was just unmatched. Everybody wanted to be around him. Everybody congregated at his home, and he just was he's a real good guy. At 12 credit semester hours left until he would be receiving his bachelor's in marketing. So his story was cut short. Um, and I dealt with survivor's guilt for a long time regarding that instance of why I lived and he didn't. So that just made me push harder as well in accomplishing some of the things that I've accomplished educational wise and sewing into people in our community from young folks to old folks um, as it relates to mental health. Because traumatic experiences, we sometimes we don't deal with those traumatic experiences and they manifest themselves in other areas of our life, as I previously indicated, whether it be jobs, family, maladaptive behaviors, with abusing substances, you name it. But yeah, Q, he's a pretty good guy. He's a pretty good guy. God rest his soul.
Yes, indeed. Rest in peace, Q. We'll dedicate the first show to Q. Really good guy. I've got a couple Q stories. I'm sure you do too. Maybe those will pop up in subsequent episodes. I want to go back to your job title, clinical mental health therapist. For those that may be unfamiliar, can you explain what a clinical mental health therapist does and how it differs from other types of therapy or counseling?
Yeah, well, a licensed clinical mental health, they say counselor, but really it's a therapist. Uh, we diagnose, we do assessments, we develop treatment plans, and we also work with clients on outline goals and objectives as it relates to different mental health disorders, whether it be bipolar disorder, one or two, PTSD, post traumatic stress disorder, ADHD, um, conduct disorder, oppositional defiant disorder, generalized anxiety disorder, just blah, 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 blah. Several different disorders. We look at the person from a holistic perspective. Uh, First, by conducting a thorough assessment, um, a mental status exam, making sure they're fit and appropriate to receive the right level of care, and if not, referring them out to a more intensive organization that can help them with that, opposed to being a counselor, such as a school counselor or guidance counselor. They don't do assessments and they don't deal with the the nuances of severe mental health disorders and diagnoses. They just kind of they work alongside, you know, clients to figure out what's going on with them, and then they'll refer them, but they don't take a deep delve into it from a clinical aspect. We have something called the DSM-5. That's the most updated version of all the diagnoses that have been established by the American Psychological Association, the APA, and there are certain criteria you have to meet to be able to be diagnosed with certain disorders. And that's one of my pet peeves as well. And this is to all the folks out there that may say these things, because people, we just say things and words matter, and they mean things. When people will say, I'm pretty sure you heard this before, oh, they're crazy. Man, she's bipolar. He's bipolar. And a lot of times they don't even know what the criterion is to be considered and diagnosed as bipolar.
Mm-hmm.
People just say things. So, with a licensed clinical mental health counselor, we kind of make sure that client meets the criterion for certain disorders, and it effectively allows us to develop a treatment plan for them to work towards whatever they're presenting issues and problems.
As far as your plan on your page in Psychology Today, You describe something called the Roy G. Biv approach to therapy. Can you tell us a little bit about that approach and how it influences the work that you do with your clients with across their various backgrounds?
Yeah, well, the Roy G. Biv approach, I'm pretty sure everybody recognizes that from when, you were a kid in kindergarten, I believe, when it started. And that's all the colors of the rainbow. Um, I myself don't work with just specific population or group of people or culture. Pride myself on being able to work with people from all nationalities, races, creeds, colors, and national origins. So I take that approach when working with different individuals. I don't discriminate or I'm not biased towards anyone. I believe as an effective um, mental health therapist, you should be able to work with anyone within different cultural norms and from a multicultural perspective. So that's what I actually meant by taking a Roy G. Biv approach, being able to work with all individuals as it relates to mental health. Um, and then also being able to recognize cultural norms versus not cultural norms, because with some individuals may do in their culture, we might, one culture might say, hey, that's weird, or I don't understand that. And vice versa, they could look at your culture and say, well, that's weird, I don't understand that. So it's just being multiculturally competent enough to be able to work with these individuals.
Got it. I want to jump back to something that you had mentioned regarding, folks throwing around terms like ADHD or bipolar and not really knowing, what criteria you have to meet to be able to be classified as having that sort of diagnosis. So, how do you spot someone who may need therapy? What are some of the signs that signal someone could benefit from your help?
High levels of anxiety. We all have some anxiety, uh, but high levels of anxiety to where it's impacting their daily functioning, interpersonal life stressors, depressive symptoms, not getting out of bed, being isolated, being withdrawn, avoidant, not knowing why, uh, your mood being destabilized for no reason, hot 1 minute, cold the next minute. Um, just recognizing those signs and finding out when the onset of all these symptoms began, it helps paint a clear picture of what disorder individual, if any, may be experiencing. And then we would reference the DSM-5, the book I was just explaining to you about with all the diagnosis in it, and it gives us a clear pathway of determining what that person could be suffering from. And they may not be suffering from all the criteria, maybe meeting some of the criteria, but if they meet some of the criteria and not all of it, you can't diagnose them as being bipolar or schizophrenic or having generalized anxiety disorder. But there are other diagnoses that are generalized with mixed mixed symptoms that can be documented if that is the case.
Well, I imagine a lot of those folks, probably the majority of those folks that may have those symptoms, they may be Googling and may see that, yeah, well, I may need to get therapy, but nah, that's not me. I don't need therapy. How do you work with someone who's skeptical about the idea of, getting therapy or seeing a mental health therapist?
Yeah, I mean, I get that a lot, um, and it's weird because it's a kind of like a two-part thing. Uh, the first would be um, breaking the stigma, which is why one of the main reasons I got into this field, because we're taught uh, don't talk about your issues, don't tell nobody our business, go to church, pray about it. Grandmama, auntie, mama, that doesn't work for everybody. We're taught to internalize whatever our issues are, past traumas, current issues, not to seek help uh, because it's telling our business. And I got into this field to break that stigma. Have you ever seen the first 48 show? And this is the example I give to clients. This is still part of part one. You ever seen the show The First 48 before?
Of course.
Right? It comes on, boom, three people were shot. Boom, two transported to the hospital. Boom, where all of them died. Right? That's how the show goes. Halfway through the show, what do you see? You see this
Yeah, freezing cold in the interrogation room.
wobbly chair.
Yeah, yeah,
Uh,
yeah.
right? Right? He might have a Coke in front of him, bag of chips. What happens? 9 times out of 10.
Oh, they tell him.
Out. Right. The
They tell him.
telling. It's not because they want to go to jail. Nobody wants to go to jail. They're telling because they normally feel better after getting it off of their chest, after verbalizing, after sharing.
I
We
got that first
naturally feel,
48 background. I had to get that first 48 background.
yeah, we naturally feel better when we talk about things. So
Right,
that's
right.
one thing. When I give them that example, they're like, "Oh, okay, I understand uh, I understand what you're talking about." The second, I'll ask them, have you gotten the physical? Has anything hurt on you in, I don't know, the last year? Yeah, what? Well, I was playing basketball, twisted my ankle, or at work, you know, something fell on my foot, or at home I was reaching for something, and hurt my arm, and oh, my back hurt. Did you go to the ER for any of those? Nah, but I went to my doctor. Okay, that's good. You went to your PCP. Cool. So you went to your PCP for what? To get it looked at because you needed it fixed or looked at. Right. So we have eye doctor. We'll go to the leg doctor, the foot doctor, the back doctor, the leg doctor. But rarely do we go to the mind doctor. We go to every other doctor
Hmm.
except for this. We'll look at fixing everything else except for this. And this controls everything. Everything. So you can control up here, you can control everything. But we rarely go see about this. We see about everything else except for the mind. So
So,
that's the two-part answer.
so once someone identifies and recognizes the need for therapy, what's that first step?
First step is finding the right fit for you. And um I would suggest that they either reach out through their insurance company or visit sites like Psychology Today, where you can find numerous therapists in your zip code. Then see if most of them offer what they call a free consultation. No more than 10, 15 minutes to even see if you may be a good fit. And if you determine, hey, it's a good fit, because everybody's not a good fit for everybody. Just for it doesn't even have to be a reason. It's just sometimes you just don't gel with people. And that's true because we got a 51% divorce rate in America. So that we know it's true. You might not gel well with someone. So having that initial conversation with a therapist and saying, okay, well, they may gel with with me, or they may align with what I'm looking for in a therapist. Start there, and then take it from there. And if you have full-time employment, you can reach out to your HR department. And I tell people all the time, use the resources that's available to you. They have what they call EAPs, or assistant employee assistant programs, where they'll give you normally it's like minimum 3 sessions free with well, not free because you pay into it, but they'll give you 3 free sessions with therapists of your choice. Sometimes they extend it out to 6, and then after that, uh, your insurance can kick in, and a lot of times, depending on people's insurance plans, they may have a copay with it. Can range anywhere from, I've seen them as low as $5, and I have some that's $141 that people pay. So that would be the first step, reaching out uh, to see if you can get a free consultation with a therapist, or visiting a place like Psychology Today, which is a great resource for people.
What role do you think race and culture plays in the therapy process, particularly when it comes to our community?
It plays a very big role, because it kind of goes back to what I was saying earlier with cultural norms. What's done in one culture might not seem appropriate in another culture, but in another culture, what we do in our culture might not seem appropriate to them. So it's just different based on cultural norms. And as a therapist, they make you take multicultural competency classes, plus uh, classes even after your license, and ethics and multiculturalism, to make sure you stay abreast upon, up on the um, new ideologies, interventions, techniques, so you're able to work well with a number of different individuals. But culture, it does play a major role in our community, because westernized interventions and techniques, and dare I say it, do not work a majority of the time with people from the African American community. It doesn't.
Mm.
I've been trained in westernized values and interventions and techniques from school, but they don't work with a lot of the individuals in my community. How do I know that? Because coming out of school, you fresh-eyed and bushy-tailed, and you want to put into play everything you learned in school. So you cross your legs and you say, "Well, somatically, James, what are you experiencing, and how does that make you feel?" Now, James has just told you that his father used to beat his mother, that his auntie used to rape him. Why would you ask him how does it make him feel? And use words like somatic, which means physically. That's
Mhm.
not that's not appropriate in that situation. So you have to know how to phrase things differently with different cultures, um, to get the best out of to get the information and the best out of that session with that person, but also to build that therapeutic and trusting bond. Because if they do not trust you, they're not going to talk to you about their deepest, darkest uh, issues, problems, insecurities, unless they have that trust. Um, so knowing what to say to whom is definitely important, because I could phrase that, what I just said, well, somatically, Jim, how does that make you feel? And he may be of Caucasian, uh, a Caucasian background, and that'll go across well with him. Or Jenny, somatically, what are you experiencing? That may go across well with her, but from somebody that looks like me, that sounds like me, that talks like me, it doesn't go over well. And I know this based on previous experiences. So culture and understanding culture, it plays a key role, because
So,
it's just important to be direct and realistic with people.
so could you share some insights into the types of therapy and approaches that you take and you offer, such as and I got this from your page on Psychology Today: cognitive behavioral therapy and person centered therapy. Tell us a little bit about those approaches.
Yeah, and those are two of the main modalities used in therapy that I do take from the Western perspective. Um, Mainly cognitive behavior therapy, because that's widely accepted and it's considered evidence based. Um, that examines the the mind, the thought processes, whether it's irrational or irrational, right? Um, thoughts, feelings, and behaviors. And I subscribe to that because I believe how we think is how we feel, and how we feel translates into behaviors and interactions. Think positive, likely to feel positive. If I feel positive, I'm likely to go about my day feeling positive, and positive things will happen. I have a pretty okay and chill day. Now, if I'm thinking negative, then I'm feeling negative, and if I'm feeling negative, somebody's getting smoked. So I like to take those interventions and modalities and apply them in everyday practice with clients, and also couple, which is an eclectic approach with person-centered therapy developed by the late great Carl Rogers, which focuses on three key principles, which is being empathetic, being congruent, which is genuine or keeping it real, and showing unconditional positive regard, meaning um, if I'm with you, right, wrong, or indifferent. I'm not going to judge you. I'm standing with you regardless. So I think those two put together, you get to forge and build a strong therapeutic bond with the client. And 6 sessions in, that's normally what it takes, 6 to 8 sessions. Uh, Folks will tell you everything you want to know about them, and then some deepest, darkest secrets, because at that point they trust you.
How long have you been in this profession?
Since I graduated 2018, uh, what is it, 2024? So practicing as licensed 6 years, or 2 years previous, 1.5, 2 years previous, as doing my practicum and as an intern. I was working with clients at that point, but under the guidance of a supervisor.
Hmm. So, over the past 6 years, what's been the most rewarding aspect of your career?
Seeing people change how they think, and taking a lion mind approach and not the dog mind, which I wrote a book about and developed a school program about. Shameless plug. We'll get to that in another episode. But seeing people think differently, which yields them to make different decisions, that's to their benefit and not to their detriment. Because when that occurs, they win, and when they win, I win. Uh, and one of my mantras with clients first starting with me is, if you're looking for a therapist who's going to just agree with you, I am not the one for you, because it ain't about money. I was in a corporate setting beforehand. Not that I was rich or anything, but I made a pretty decent living. It's not about money. My mantra is, I'm about impact, not income. Of course, that's how I paid, my office rent, but I'm more so concerned with impact, because if I can help you change the way you think and the way you look at things, then everything else is likely to change, and then that'll start manifesting in other areas of their lives.
What do you what do you hope that listeners take away from this show, not only from this episode, but episodes moving forward?
That it's okay to talk to somebody. It's okay to break that stigma, break that label. We all look. We're social creatures. We're not meant to be alone. All of us, we have pairs, man, woman, uh, lion, lioness, you name it. We come in pairs. We're not meant to be alone. We're social creatures. So it's okay to talk about things that you're going through, because people for too long have been okay with compartmentalizing things. And not to say that you can't compartmentalize things, but when that's all you do, and you just right? I give the example in therapy. You go to Dollar Tree, right? And it's somebody's birthday, your nephew's birthday. And you're like, okay, I want the number three balloon over there. And the lady, she goes over there. This one? Yeah, that one right there. She gets the balloon. She takes it over to the helium machine, right? She puts it on there, boom, and she turns it on. But then she walks away to go service somebody at a register or tell somebody where the Vienna sausages is. I don't know, right? What happens to the balloon? It's gonna bust. That's the same thing that happens with people. When you put too much in here and don't deal with it, aka walking away from the helium machine, you're either going to implode or explode. Neither isn't good. So I hope people take away that it's okay to talk about things that you're going through. Sometimes you can't do it with families, friends, or the pastor. Sometimes it needs to be a stranger who's unbiased, that doesn't have any buy-in. I tell people all the time, respectfully, whether you make these adjustments or not, it doesn't matter to me. Respectfully, not to, I mean I care, but if you do it or not, it doesn't matter. It doesn't affect me because I'm looking at it from a different lens. I'm being objective, and that's what people need a lot of times. Somebody that's going to care, that's going to be, congruent, genuine, be empathetic, show them unconditional positive regard, but also, that's unbiased. And folks need that. And sometimes just reaching out to talk to people about things that they're going through, it starts the facilitation of the healing process.
That's great, man. Well, I appreciate you giving me the opportunity to host your show. I think it's been a really good discussion. Look forward to more shows in the future. Before we go, tell your audience a little more about your clothing line, Ego, and how it's helping you to increase awareness for mental health.
Yeah, Ego is a clothing line I developed during the pandemic. Started making clothes and was just creating, and this came about, and I just started expounding upon it. Ego is a term that was developed by Sigmund Freud. There's three parts to it. People misuse it all the time. But there's the id, the superego, and the ego. The id is kind of like the pleasure principle, like the little devil on your shoulder. I want it now, now, now. It's me, 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 selfish. The superego is kind of like the angel on your shoulder, the moral principle. No, you shouldn't listen to that guy. You should do the right thing. Uh, Kumbaya. Let's be good together. And then you got the ego, which is one sense of self, the executioner, the executive, the decision maker. Am I going to listen to this one, or am I going to listen to this one? That's what ego is. So I just wanted to develop this clothing line to bring more awareness to mental health, but also being mindful. We can accomplish a lot and make better decisions if we're mindful about things. Just taking 1 second to be more mindful. Will this help me, or will this harm me? Will this help someone else, or will this harm someone else? Just being mindful, um, and that's what it was developed for, to push awareness about mental health and all of our communities. And my wife, she came up with a good slogan for it. I can't take credit for that one, which is everybody got one. EGO, everybody got one, and it's true. Everybody has an ego. So it kind of went hand in hand, and we pushing it through fly designs and different artwork, and it's a conversation piece. And people see ego and they think of Beyonce song. You got a big ego. Well, what does that mean? What does big ego mean? If we're using it correctly, most times people can't answer that, and that's when you start educating them about it. And you say, "Oh, okay," and then you normally find out, "Well, I've been going through such and such, and I've been experiencing this," and before you know it, you're booking them for a session, or you're referring them out to another mental health professional to talk about some of the things that's been troubling them. So it's been um it's been very beneficial thus far with spreading the message and then getting people to realize that they need to deal with some past traumas that they carry from either the present, but more so from childhood into adulthood, because people forget and people tend to forget. Adults are children. Children become adults. They're not a different person. They're that same 6, 7 year old kid, just older. And if they were professional rug sweepers or they have unresolved trauma, it's going to manifest itself in other areas of their life. And it's important to deal with that, because if they don't, then they turn to substances like I did with alcoholism. Some friends of mine I know with alcoholism and different drugs, and it affects other areas of our life, losing jobs, losing money, losing relationships, marriages, family members. Um, it just does a number on us. So I'm here to change the narrative um, by being a new face of mental health and being that ambassador. So,
Well, I'm happy to be on this journey with you, man, and looking forward to helping people through their mental health challenges. Um, are you going to send me some new ego clothes, or should I wear the same shit every episode?
yeah, no, I got you. I got you. I got you. I got some stuff for you. I got you.
Cool.
What size you an XL?
I'm working down to a large.
Okay. All right. Working down to a large. All right. So yeah, I put some larges to the side.
That's what's up. And shout out to your wife for coming up with the name. That's awesome, man.
Yeah, no doubt, man. Appreciate it. All right.
Yes, sir. Well, I enjoyed this first episode. Let's do a lot more, and everybody tune in. We'll have some really great content for you in the future. It's
No
been
doubt.
New Ego with Dr. Coffey.
Peace.